Professor Ham, what are the suggested changes to the Health and Social Care Bill from this report?
The biggest change is less emphasis on competition and the role of the private sector, with more emphasis on the need for integration, collaboration between GPs and specialists, between health and social care, centred around the needs of patients. And that reflects the concerns that have been expressed by patient organisations and staff groups that if the health service is opened up much more to competition, that could lead to cherry picking, and it could be harder for providers to collaborate with each other where that will bring benefits for patients. So these are welcome recommendations which will have clear implications for how the bill is drafted.
And what do you think is the most significant change in your opinion?
Some of the most significant changes centre on the proposals for GPs to take a lead on commissioning in future. What the government now will have to do is decide how to respond to the forum's report, its recommendations particularly that other clinicians, not just GPs, should be involved in advising on the decisions of commissioning consortia, hospital doctors, nurses, allied health professionals, and also the commissioning consortia should only take on full responsibilities when they're clearly ready to do so. So it'll mean a longer time for implementation of these changes, not everybody taking on budgets by 2013 and commissioning consortia having to have the expertise available before they do so.
And are these changes in line with Cameron's 5 guarantees for the NHS announced last week?
There's a lot of overlap between what the Forum is proposing and what the Prime Minister said in his speech last week. Not surprising, because the Prime Minister will have had foresight of the report. The two big differences are the commitments the Prime Minister made last week. First of all, to keep waiting times for treatment low, and secondly, to continue increasing NHS spending in real terms over the next few years. Neither of those proposals is in the Forum's report, but they're very important from the point of view of patients who want to be reassured that they'll still have good, quick access to healthcare and that funding will not decline, even though economic times are pretty tough at the moment.
And what would you have liked to see in the report that perhaps isn't there?
The big omission in the report from the King's Fund's point of view is any real discussion about how the organisation, the location of clinical services needs to change in future if we're going to implement the model of care set out there. Because the Forum's very clear, there needs to be much more emphasis on care closer to home, on prevention, on helping patients to self-care, look after themselves. That means less resources being committed to our acute hospitals and some services being concentrated in fewer centres to get better outcomes and better results for patients. That's a really challenging agenda for the government, and the Forum really makes only passing reference to that. So I hope that as the debate goes forward, we'll have much more discussion on the need for services to be reorganised to improve patient care.
And what are the next steps? How will this report be implemented now?
The government has to decide how to respond to the report of the Future Forum. We're expecting the Prime Minister and the Deputy Prime Minister to make an announcement tomorrow on their initial response, with more detail to follow on from that. They'll have to decide how many of the recommendations to accept. All the indications are that they will welcome the Forum's report and they will take on board most, if not all, of the proposals that are being put forward. They'll then have to decide how to change the legislation. The Health and Social Care Bill will look different as a result of the Forum's report and the proposals set out there. So the bill will have to go back into Parliament for further debate and discussion. All of that should become clear within the next week or so.
So finally, did the Future Forum do their job? Did they listen to the right people?
The Future Forum's done a really good job in our view. They've been out and about talking to patient organisations, staff groups and other stakeholders. They've done a huge amount in a short space of time, and clearly their report reflects that. Comprehensive assessment of the strengths and weaknesses of the government's proposals and of the Health and Social Care Bill. They deserve a lot of credit for working so hard and coming up with a very practical report with some sensible recommendations that I think most people want to endorse and support.
Professor Chris Ham, thank you very much.
Okay.